Hello, my name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature. And on behalf of our Chairman, Robert Doherty, and the rest of the Sullivan County Legislature, thank you for today's Town Hall. Joining us today is our County Manager, Joshua Potosik, our Director of Public Health, Nancy McGraw, and the Commissioner of the Division of Health and Family Services, Stephanie Brown. We're going to start off today with our, as we usually do, question goes to Nancy. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy?
Good afternoon. So over the weekend, we had a pretty quiet weekend. We only saw one additional new case. However, as of this morning, there were 24 additional positive cases. That brings our total confirmed cases so far to date to 1,238. The mandatory quarantine and the number of people who are no longer on isolation that I'm going to read is from today and slightly different from the numbers on the dashboard, which was updated early this morning. So I have the latest numbers. 971 are on mandatory quarantine, and that is a decrease from over the weekend. 2,066 people are no longer on isolation, and they are well, so that is good news. We're holding, we're holding steady at 28 deaths. There's been no additional deaths. We are monitoring 316 active cases of COVID positive individuals, and so far today, 5,793 people have been tested amongst Sullivan County residents. 23 people are currently hospitalized. That's a slight increase, and 4 of those individuals are in the ICU and on ventilators. We had a another testing clinic Friday in South Fallsburg, and there was only one person who tested positive from that clinic, and I think about 23 people were tested, so that is good, and that's where we're at right now.
Thank you, Nancy. And before we get to the rest of our questions, I am going to go over to Stephanie Brown, once again our Commissioner of the Division of Health and Family Services, and she's got some important information she will share to the residents of Sullivan County. Stephanie?
Good afternoon, everyone, and thank you for allowing me this opportunity to share some more information with you and join this great team of people here. So firstly, I'd like to get started with an update on the care center at Sunset Lake. To date, we have a cumulative number of positive cases of 48. Unfortunately, 9 of those cases did pass away, and we offer our sincere condolences to the family and friends during this difficult time. I want to give a special shout out to all of the employees and all of the really dedicated people working at the care center at Sunset Lake. These are a phenomenal group of employees and workers, and I want to say thank you on behalf of myself and everyone here in this room and the county. Thank you so much. So moving forward, I want to talk a little bit about the new county COVID dashboard that debuted. And we actually have it here behind me, so I'm very excited to talk a little bit about this. You'll see that the layout is very similar to the previous dashboard, but the main difference that you'll notice here is that this map is actually very interactive, meaning that if you would like to check by zip code, if you want to click on the map in the center, you can actually click on one of those shaded green areas by zip code, and it will tell you the cumulative total number of positive cases in that area. And in addition to that, we also have the option of, if you're looking to get tested, there's a local testing site tab that you can go to where you can get some information on local testing sites. There is also a comparative trends area where you can take a look at our curve. So there's a lot of really great information on the dashboard. I want to give a special thanks to Jennifer Stone in our GIS department. She did a lot of work, put a lot of work into this, and it's pretty incredible, and it shows. So if you're looking to access that map, you can go to sullivan.ny.us and click the link on the banner, and it will take you to more COVID information, and that beautiful new interactive dashboard is right there front and center for you. Some more positive information I'd like to share. Our Department of Community Services is now offering medication-assisted treatment for individuals with opioid misuse disorders. People who are addicted to opiates, they crave more. They continue to use even though they know that this is not a good thing for them to do, but they continue to use because their body craves more. What medication-assisted treatment does is allows the provider to have some control over an opiate-like medication that affects the individual similar to the opiate, but it's a controlled dose. So that individual is not going out and well, ideally they're not going out and taking more of the medication. It's in a controlled setting, and it minimizes issues with withdrawal and really improves the success of these individuals in getting off of that medication. So a very, very special thank you to Melissa Stickle over at the Department of Community Services for all of the work that she's put into getting this program up and running. It's really, really, it's pretty incredible, especially considering some of the issues that we have impacting our area. So if you want more information, you can call 292-8770. And those are my updates for now.
Thank you, Stephanie. Okay, now on to some more questions. And once again, thank you for submitting your questions. This one goes to Nancy. Since cases of coronavirus are reported by county of primary residence, how will health officials know the true number of cases in Sullivan County, both now and in the coming weeks, especially now that so many more people are here? And will those figures be released to the public? Nancy?
Thank you. I believe we may have had this question in a previous town hall, but it bears repeating. I want to remind everyone that cases are counted by county of primary residence, and so those individuals who test positive are given an isolation and quarantine order by the county health department in which they live. They should not be leaving their home to travel anywhere until they are released from the county health department and are cleared to go. So I really sincerely hope that people would not be traveling and leaving their home if they know that they have been exposed to a positive case and they're in quarantine, or if they've tested positive and they should be isolating at home. So we really don't know if people are going, people that come here during the summer, whether they are testing positive or not. But the contact tracing initiative that's being rolled out may change that. People are not prohibited from traveling unless they're on the isolation and quarantine order. So we would hope that people would abide by that to limit further spread.
Thank you, Nancy. Next question is for Josh. What's the latest on summer camps reopening in Sullivan County? Josh.
It's actually nothing new to report as of this time. We're continuing with the EOC Public Health to work with the camp operators on how they could open safely. We're still awaiting word from the New York State on guidance or determinations on if they can open and to what capacity. We ask this question literally every day on our regional call with the governor's representatives. We're hearing we may get an answer this week, but there's nothing set in stone that we will, so we're hopeful. Obviously, to have if they are to open safely, we need appropriate time to plan and to have camp operators put in procedures and protections to allow them to open safely. But as soon as we hear camps, we'll be surely letting the public know on the determination or guidance. But we are still waiting, like everyone else, from the state to provide that information.
Thank you, Josh. Next question is for Stephanie. I've seen numerous people swimming together in the rapids at Fallsburg. Is it legal to do so? What can be done to ensure their safety from COVID exposure? And Stephanie will answer not so much from a legal perspective, but from the safety from COVID exposure perspective. Stephanie?
So firstly, I want everyone to be sure that they are following signs, and if there are signs that say no swimming, no trespassing, please do adhere to those signs and don't swim or trespass in areas where there are clear posted signage. But I understand the allure of wanting to get out and wanting to enjoy the weather, especially now that it's gotten a little bit nicer out, and we'll continue to see more of that nice weather. But it's very important to know that although COVID is not known to be transmitted through water, the restrictions are still in place when it comes to public gatherings. And so people that are maintaining close proximity out in public, there are still restrictions on on public gatherings. So it's very important to continue to observe the at least 6 feet of social distancing when you're out in public, making sure that you continue to wear your mask when you're out in public, doing all of the things that you are supposed to be doing when you're out in public spaces, and that includes areas where you should or shouldn't be swimming.
Thank you, Stephanie. Next question is for Josh. When will the county reopen its parks, and what rules will be in place?
So, timely question. The parks are open today. They include the Lake Superior State Park, Stone Arch, Minisink, Battlefront, D&H Canal Park, and the Livingston Manor Cover Bridge. Obviously, with restrictions, bathroom facilities will not be open. You'll have to maintain your social distancing. And the building at D&H Canal, the Interpretive Center, will not open, and our other remaining park, Fort Delaware, will remain closed until we are on pause. So they are open today. Please social distance yourself, wear a mask if you can't do that, and enjoy some of the beautiful parks that we do have in this county.
Okay, next question is also for Josh. It is a long one, so please bear with me. A comment was made at the last town hall that summer rental properties are currently open. I checked out the Facebook pages of large businesses such as the Villa Roma and the Sullivan, and they appear to have no or minimal activity. Did you mean the bungalow colonies? How would they be allowed to be rented? This CDC guidelines state under the stipulations for consideration for a Phase 2 opening, regions must not open attractions or businesses that would draw a large number of visitors from outside the local area. Do you think rentals should even be opening?
Well, hotels from the beginning were never outright prohibited from staying open. They were deemed essential to be able to house healthcare workers and to also house people under quarantine or isolation orders if they couldn't appropriately stay at their house with their family. So they have been open. Seasonal rentals are likewise is open. The Airbnbs and seasonal residences are open. There's been no prohibition from New York State on being able to occupy seasonal residences, so they are open until further notice.
Okay, next question is also for Josh. Do you think the influx of summer visitors is going to have a positive or negative effect on our county trying to open up at Phase 1?
That's a great question. I think it speaks to the larger question of trying to open up the economy in general in New York State, Sullivan County, Mid-Hudson, but in the country in general, right? It's the balancing act of keeping everyone safe and healthy and not flooding our hospitals, but at the same time having our economy get more productive. So I think done in a safe manner, summer visitors can have a positive impact on our economy. A lot of our businesses see a large uptick. Certainly the tourism industry sees a large uptick in business when our summer visitors are here, whether they're restaurants or small hotels. So I think it's kind of crucial at some point in a safe manner to get those types of businesses being more successful. So I think if people are responsible, social distance, wear face coverings if they can't stay 6 feet away, wash your hands, we can have both residents and visitors in this county at the same time safely, but it takes personal responsibility to do that. Whether transmissions can happen, whether it's residents being irresponsible or visitors being irresponsible, it takes everyone that is here to be responsible to have a safe, successful summer.
Thank you, Josh. Next question I'm going to answer. Is there a possibility of Sullivan County reopening when we hit the requirements, even if the rest of our region has not? Sullivan County will not open on its own. We will open when the region that we're part of, which is the Mid-Hudson Valley region, is ready to open. And there has not been a date set, but we are getting close. Like our county manager just mentioned, there is a balancing act between opening things up and being safe. It always comes back to, as our county manager alluded to, proper good personal judgment, common sense, and as so many people have been showing, and that's why things are starting to open up a little bit throughout the state. So anyway, we will open up when the region is ready. Next question is for Josh. Having a small business, we are planning for eventual reopening. There are numerous guidelines, some very general and some very extensive. What level of documented plan, if any, do you think will be required to meet reopening requirements?
Another great question. Obviously, with this pandemic, there's a lot of information coming from a lot of different places, whether it's CDC guidance or DOH or New York State itself. But there is a requirement to be able to open that you have to comply with to open your doors once phase 1 hits, and if you're in subsequent phases 2, 3, and 4. So the state has called it a business reopening safety plan that you have to fill out and post in your workplace. And that does include businesses that were never required to be shut down because they were essential, and any new businesses that would be coming in these subsequent phases. You could find that on the governor's state webpage. It has various questions such as how do you maintain the social distancing of 6 feet? What kind of equipment do you need? If you can't maintain social distancing, how do you mitigate any exposures from those services that you can't provide within 6 feet? So that has to be posted in your workplace. It doesn't have to be sent to any state or local regulatory agency. You have to have it on file for review by DOH or a local regulatory agency if there should be issues down the road. But it's a pretty basic form that you should be able to fill out, answering some of the various questions we talk about at every town hall. Washing hands, PPE requirements, 6-foot social distancing. So I think it's a tool that the state has provided for you to fill out. You can use your own business opening plan and not use the state's tool, but it has to touch on a lot of the same issues that are in the business reopening plan that the state has provided.
Thank you, Josh. And our last question today is once again for Josh. Governor Cuomo has referred to each business requiring a liability plan. Can you provide more details about what that would entail?
Yeah, we talked a little bit about this internally today, but we're not aware of any per se liability plan that is required. I mean, I think there's been some talk about at the federal and state level about if we are going to allow businesses to open, how do we protect them from a liability standpoint if people get sick, and it's tied back to their business. But there's no formal liability plan at a federal or state level that we're aware of at this time.
Thank you, Josh. Okay, and that's it for our questions today. Thank you once again for sending in the questions. I want to thank Josh for being here, Nancy for being here, and Stephanie. And in closing, our census, which we mentioned here in the past, we're still low on the number of people who have responded. So please take time out and fill out the census. It's important for your county, not just for representation, but for the financial piece as well. And now as the weather gets better and we get itchy to get outside, just always remember to practice the social distancing. I mentioned this in the past, so it's something worth remembering, that we always do our best when we as a people honor our own humanity by respecting that of others. With that, I'll say have a good afternoon, be safe, bye for now.